Yeah, so with POTOMAC, we set out to improve the outcome of high-risk non-muscle invasive bladder cancer. For many decades, more than 4 decades, non-muscle invasive bladder cancer was treated with BCG instillation therapy, and there has been no progress. So our idea was to add systemic immunotherapy with Durvalumab to BCG induction and maintenance therapy, for 2 years in our study. The usual standard is something between 1 and 3 years of BCG maintenance. The reason for BCG not working might be the upregulation of PD-L1 in the bladder. So we thought that the introduction of 1 year of immune checkpoint inhibition with Durvalumab might improve the outcome, which is disease-free survival in our trial. Well, the study was a global randomized phase 3 open-label study. We included 1,018 patients into the trial. The patients were adults and median age 68, good performance status. They all had to be BCG-naïve with the diagnosis of high-risk non-muscle invasive bladder cancer, which was defined by the EU guidelines 2017 at the time when we designed the trial. Yeah, so we randomized patients into 3 arms: 1 year of Durvalumab plus BCG induction and maintenance, 1 year of Durvalumab plus BCG induction only, and BCG induction and maintenance as the control arm. First endpoint, disease-free survival, and POTOMAC was a positive trial. Disease-free survival was improved by 32% in the total population, so the ITT population. This was highly statistically significant. The hazard ratio 0.68 and the p-value 0.0154. The curves, by the way, separated very early and stayed apart throughout. The median follow-up was long with 60.7 years, and this is the longest we have seen in this area of research. Well, safety showed that the combination of Durvalumab plus BCG induction and maintenance is tolerable and manageable. Of course, with the addition of 1 year of Durvalumab, we see additional immune-mediated side effects from the systemic therapy. We saw 8% of grade 3 and 4 immune-mediated adverse events. Otherwise, we did not see an increase in BCG-mediated side effects. So the local treatment was not worse with the addition of Durvalumab. So the POTOMAC study supports 1 year of Durvalumab in addition to BCG induction and maintenance therapy as a new treatment option in high-risk non-muscle invasive bladder cancer.